Hello, welcome to the Pharmacology and Medicinal Chemistry of the Quinolones in the MCQ section. So the first question says that which of the given options is the first member of quinolones that is used to treat the urinary tract as well as gastrointestinal tract infections? And the options are nalidixic acid, gatifloxacin, enoxacin, and synoxacin. So, friends, first you all need to know that the first member of quinolones, which was first discovered, is nalidixic acid. Even synoxacin is the first member agent of quinolones, but the question here is asked which is the first member of quinolones. So the most suitable option will be nalidixic acid. Okay, the others are fluoroquinolones, that is gatifloxacin and enoxacin. So these are ruled out. Hence the correct answer here is nalidixic acid. The next question says that in the general structure of quinolones, the carboxylic acid is attached to which carbon number? So to answer this question, you all need to know the general structure for quinolones. Okay, so that can be given as this. So this is the general structure of quinolones. This is the quinolone ring. At the first nitrogen, it is numbered as 1, 2, 3, 4. This is 5th, 6th, 7th and 8th. So at the first nitrogen, we have the R1 substitution. Second carbon is having no substitution, but the carbon number 3 has carboxylic acid attached to it. So the correct option here for the given question is option B, that is carbon number 3. Next question. Quinolones are bactericidal and inhibit the following bacterial enzymes. So here they are trying to ask you the mechanism of action for quinolones. The options given are A. DNA gyrase, B. topoisomerase 1, C. topoisomerase 4 and option D both A and C. So for this, mechanism of action of quinolones is, as you all know, they are rapidly bactericidal. They will inhibit the DNA gyrase and topoisomerase 4. Okay, remember topoisomerase 4 को वो लोग inhibit करेंगे and not topoisomerase 1. So gram negative bacteria में क्या होता है? The fluoroquinolone will inhibit the enzyme that is DNA gyrase. So gram negatives में DNA gyrase inhibit होगा and gram positive में topoisomerase 4 inhibit होगा. So remember, these two enzymes are responsible for the conformation of the DNA. Okay, what will they do? जो catalyze करते हैं हमारे जो DNA strands जो उनका nicking होता है, these quinolones will inhibit the bacterial DNA gyrase and topoisomerase. They do not do anything to the host cells. So that is why bacteria का जो DNA synthesis है, that is interrupted. Hence the correct option here is D, that is both DNA gyrase and topoisomerase 4 is inhibited by quinolones. Next question. Mechanism of resistance for quinolones can be given as. So the options here are increase in the drug efflux, decrease in outer membrane permeability, spontaneous mutation in the bacterial genes, and all of the above. So you need to know कि yes, bacteria are developing resistance towards the quinolones. So spontaneous mutations होता है bacterial genes में जो responsible होंगे क्यूनोलोन टारगेटेड प्रोटीन्स पर एक्ट करने के लिए. सो म्यूटेशन किसमें करेंगे बैक्टीरियाज? अपने डीएनए गायरेज एंजाइम पर एंड टोपोआइसोमरेज 4 पर. ओके, सो दीज एंजाइम्स, इनके लिए जो जीन्स कोड करते हैं ना, those are getting mutated. So DNA gyrase and topoisomerase 4 का spontaneous mutation होगा. Then increase in the drug efflux or decrease in the outer membrane permeability also takes place, which will affect the drug influx. So this mutation, that is A and B, it is more commonly seen in the gram negative organisms because they have a more complex cell wall than the gram positive organisms. तो gram negative के पास complex है cell wall, okay, but gram positive के पास सिर्फ एक cell envelope है. Okay, so these A and B are more seen in gram negative ones because they have a complex cell wall. Okay, so here the correct option would be all of the above because all three mechanisms of resistance are seen in the bacteria for resistance against quinolones. Next is example of first generation quinolones are. So for the first generation quinolones, remember you have only two examples, that is nalidixic acid and synoxazine. So yes, the correct option here is option D, that is nalidixic acid and synoxazine. Both A and B are the examples of first generation quinolones. Next question is, levofloxacin is an active levo dash isomer of ofloxacin. Okay, so remember levofloxacin जो है वो levo form में तो है ही, but it is an S minus isomer of ofloxacin. So remember this structural point for levofloxacin, उसका S minus isomer is the active isomer of ofloxacin. Next, R6 in the quinolone structure is responsible for the following drug activity. Now, the structure of quinolone has a lot of substituents. हर एक substituents का अलग-अलग activity होता है. All the substituents are responsible for their own specific activities. Okay, so यहाँ पर हमको पूछा है R6 के बारे में. Now let's see. This is the major general structure for quinolones. As you can see, the nitrogen containing ring is the pharmacophore. Then the substituent at the first nitrogen, this R is responsible for the potency of the drug. R6, which is our given question, is responsible for cell wall penetration, but R7 is responsible for the spectrum of activity. Hence, R6 will be responsible for option number B, that is cell wall penetration. So remember this general structure for quinolones and their specific activities and the substituents responsible for those activities. Moving ahead, which of the following is a third generation fluoroquinolone? For this, you all need to know the classification of fluoroquinolones very well. Nalidixic acid, as you know, it is the first generation. So for third generation, you need to know this table very well. Okay, the examples for first generation is nalidixic and synoxazine. Second generation has nor, cipro, lomi and enoxazen. Third generation has levo, spar, gati and genifloxacin. So here we have gatifloxacin as the option A. That is our answer. The third generation fluoroquinolone is gatifloxacin. Other, that is cetafloxacin, clinafloxacin, moxi and trova, belong to the fourth generation. So remember this classification table very well. Next, in quinolones, the highest photosensitivity is seen with which drug? So this comes under the adverse effect of fluoroquinolones, and remember the example, that is sparfloxacin is the drug which shows you highest photosensitivity. Okay. Then we have gatifloxacin, which will show you QT prolongation. Okay, QT prolongation is seen with gatifloxacin. Other drugs, that is sparfloxacin and moxifloxacin, will also show QT prolongation. Okay. However, trovafloxacin will give you broadest spectrum of activity. So remember this, trovafloxacin is responsible for broadest spectrum of activity, sparfloxacin for photosensitivity, gati, moxi and sparfloxacin, it is also responsible for QT prolongation, that is torsade de pointes. Next question says that which of the following is the most lipid soluble fluoroquinolone? For this, you all need to know the structure of all the fluoroquinolones, or at least their structural specificities. The options are norfloxacin, gatifloxacin, pfloxacin and synoxacin. So when they say most lipid soluble, the correct option for the quinolone goes to pfloxacin, as it is the highly and most lipid soluble fluoroquinolone available. So what is the reason of its highest lipid solubility? So we have the structure of norfloxacin, and here R is the ethyl group. Okay, but we have one more derivative of norfloxacin, that is pfloxacin, and this is the structure for pfloxacin. So here instead of NH in the ring, we have a methyl substitution. So this will increase the lipid solubility of pfloxacin, and hence it is the highly lipid soluble drug which is absorbed maximally from the body. Okay, hence the correct option here is pfloxacin.